Out in just a second, Brad. This is gonna be Bradley's speech. I guess number one. Here's the people he kidnapped. Alright.
Alright, I'm Bradley Holmes. I'm a student nurse at PRCC, which you should know, but that's for the camera. If you don't know me, shame on you. I'm here to talk about electrolytes. People most normally think of things related to health as heart disease, diabetes, cancer. The only place that people outside of the nursing field really are going to hear about electrolytes is if they're in, Powerade and Gatorade. But, you'll never hear it in the obituary. Somebody died of electrolyte imbalance. But the heart attack John Doe might have had might have been caused by a potassium problem. Electrolyte imbalances are intensified, or they can intensify diseases. They're necessary directly and indirectly for every function of the body. They're responsible for things such as water balance, heart rate, rhythm, muscle movement, and more. But they have a very narrow range. Since I'm doing this to y'all, I'm going to say this as noticing the imbalance without the lab test, which we'll have the liberty of doing. First, we have to begin with the overview, risks and causes. Since electrolytes are based on concentration, you can have an actual deficit or excess by having too much or too little of the actual electrolyte, or you can have a relative excess or deficit because of too little or too much water. Loss is mainly from sweat, urine, and feces. So people who sweat a lot, people with kidney disease, people taking medicine for blood pressure, specific kinds can cause loss of electrolytes. A good way to tell without even noticing symptoms is look at the diet. If you can't have more than you're taking in, it doesn't just magically appear. Moving on to individual electrolytes, I'm only going to go over 3 for now. Sodium. Somebody in your family, a friend, or maybe you've been told to watch your salt. And salt's main purpose is fluid balance and nerve impulses. Low sodium causes fluid loss because the body will attempt to correct concentration by purging the water. It causes muscle weakness. Nerves become less effective. There's sudden depression or confusion, muscle weakness, and decreased reflexes. Too much sodium causes water retention, which is a very significant cause of high blood pressure in America. Most Americans ingest about 6 to 13 grams of sodium per day, which the allowed is normally 2 to 4. The body retains the water, but it pulls the water out of the cells, causing dehydration. One of the best ways to monitor that is to get daily weights of more than 1 to 2 pound weight gain is considered fluid retention. The neurological changes are decreased attention span, agitation, mania, and nerve instability. Muscle twitching and irregular contractions at first, and weakness. Then if it gets severe enough, let's hope it doesn't, you have seizures. What some people do to reduce their salt is they use salt alternative. They don't want to cut down on the taste of salt, so they just pour a ton of that on their food, and they don't realize what salt alternative is, and that's potassium chloride, which is the next one. Potassium has a very narrow range, and it plays a role in every role of each cell. Reduced potassium causes lack of muscle responses, orthostatic hypotension, there's a stronger stimulation needed for muscle movement and reflexes. Breathing may become shallow. Check for lack of oxygen. Check for blue nails or blue lips or unstimulated anxiety. The heart is the most critical target of potassium. Heart rate becomes irregular and it changes from fast to slow. Constipation and abdominal swelling are common because of the lack of muscle movement. In severe cases, which you should notice this before the person falls into a coma, but they can fall into a coma. High potassium causes life-threatening heart problems. What I've noticed, the easiest way to remember the muscle changes with this one is that they start with a twitch or numbness and tingling of the mouth, hands, and feet that turns into weakness and it moves up the body. Heart rate slows down. With severe excess, the heart rate will completely stop, or it can skip beats, or even the blood pressure drops significantly. Now the next one, most people don't think of calcium as an electrolyte, but it does more than just build strong bones and teeth. It regulates muscle conductivity, and what I found that easier to remember this by is that it's regulating. It doesn't actually cause instability. It's regulating the others. The best indicator really is the muscle spasms you have at night that wake you up in your calf or your leg. That's from low calcium. If you apply a really tight pressure to cut off the oxygen to your arm, your hand will bend up and curl and spasm. If you tap your face right below the ear and in front, like right here, if you have low calcium, it should cause a spasm. Some other things are abdominal cramps and diarrhea due to the muscle instability. Increase in calcium, if it's sudden, it can cause an increase in heart rate and blood pressure, but if it occurs over time, it actually causes a drop. Increase in abdomen size due to intestinal immobility and constipation, and severe muscle weakness, and loss of control without the numbness or tingling. And also it plays a role in clotting, so if blood flow is already low in a place such as where you're wearing tight socks or tight clothing, you can develop a clot there. The best way to check for that is the affected extremity check for blood flow. And of course, we'll have the liberty of getting labs. We always get our labs, but it'll give you a heads up, if there's no other indication, if there's no other disease present, if it's sudden. And really the point of knowing this is to protection and prevention. So, any questions?